Got a picture of a heart here. You can see these are all the main arteries of it. These are the ones that can be blocked. Any of these can be blockages. So, and that correlates with each part of the EKG as well. This is kind of just something you could screenshot if you wanted to. This shows each site. If you have elevation in V1 and V2, be a septal wall MI. If it was in V1, V2, V3, and V4, that's an anterior septal MI. What this is talking about over here is reciprocal changes. If you look at this and you see a patient that is having elevation in lead 1, AVL, V5, and V6, you would see elevation there. If you then, in that case, you would see what's called a reciprocal change, which would be depression in leads 2, 3, and AVF. That's the only time where reciprocal changes and depression really matters, is looking at that. And that's really just more of a way to confirm the MI than it is to treat anything. This is just something good for reference too that I found in here. It's the H's and T's of ACLS. The H's and T's of ACLS kind of just show you what could be the cause of the cardiac arrest or the cause of the going into different arrhythmia or anything. These are reversible effects that you could look at, find out what could be going on with your patient. Post-cardiac patients, pericardial tamponade is, or cardiac tamponade, that's a common occurrence you'll see with them, the fluid buildup around the heart. This treatment is pericardial synthesis, the draining of the fluid around there. You really won't see a whole lot of this in the hospital setting. Aside from this, you will see thrombus. Could be MI. These patients who are coming back from surgeries, very susceptible to clots causing heart attacks, PE, whatever be the case for the thrombus. And the thrombus again for the lungs or the heart, either way. Hypothermia, you won't see a lot. You could see the hypokalemia. Hypoxia can cause it. Hypovolemia can as well. Cardiac patients, not quite as much, but any surgery patient is always at a risk for bleed or loss of blood. That's just reversible causes that you can look at and fix as you're going through the process of working a code or trying to decipher what could be the cause of the rhythm change. I'm just going to kind of put these on here just so you could look over them for your reference. It's the ACLS guidelines for acute coronary syndrome, how the ACLS looks at treating heart attack MI. Here's the algorithm as well for tachycardia. Bradycardia is there as well. It's got the drugs listed. Here's cardiac arrest. Shows the shock, shows the dosage rates of what you would give for all the drugs too.